Hi, in this video, I'm going to be talking about breastfeeding during and after treatment for breast cancer. Why would you want to breastfeed when you're going through all of this? Well, if you're watching this video, you probably already know that breast milk is really good for your baby. If you choose to breastfeed around the time of your breast cancer treatment and diagnosis, there are a couple things you need to know. Number one, you can breastfeed after lumpectomy. So let's say your breast cancer treatment predates your getting pregnant and having a baby and breastfeeding. You should be able to breastfeed on both sides if you keep the breast. That is, if you have breast conserving surgery, also called lumpectomy. Having the lymph nodes removed on the side of your breast cancer does not impair the ability of your breast to make breast milk. If you had radiation therapy after surgery, there can be some disruption, indeed, of the milk-producing ducts, and you may find that you make less milk on the side where you had radiation therapy. If you had a double mastectomy, that removes all the breast tissue, and you will not be able to make breast milk. What about chemotherapy, targeted therapy, endocrine therapy? For my patients who've wanted to breastfeed, who will be receiving one of these systemic forms of treatment that go through the whole system, we recommend that you bank breast milk before you start chemotherapy, targeted therapy, or hormonal therapy, and that you not feed the baby with milk after you've received these medications. What if you had them before, or you want to take a break in your treatment? For example, you have chemotherapy and maybe targeted therapy, and then have surgery just after you have the baby. You should be able to pump breast milk before you start your next therapy. So let me give you a particular case of somebody who's pregnant when she's diagnosed and she's receiving chemotherapy and targeted therapy, which are actually safe for the baby in the second and third trimester. Not targeted therapy, but chemotherapy, safe for the baby. You can pause, have surgery, have the baby first, then surgery, and then bank breast milk and breastfeed the baby with that early breast milk called colostrum, which has the most healthful benefits to the baby, and then resume systemic treatment. So perhaps, for example, you'll be getting additional chemotherapy or targeted therapy, or starting on endocrine therapy. We, again, would recommend that you bank as much milk as you can before you start systemic therapy again. A couple other things. There are people who make a lot of milk who want to donate their milk. The milk is tested, the donors are tested, the milk is very safe. This is another way to give your baby breast milk. And then the last thing I want to say is you don't have to breastfeed. There are lots of people who don't, who can't. It doesn't mean you're providing inferior care to your baby. So talk with your medical team about your options and the ways you can have that relationship with your baby that you want to have, knowing that your best is good enough. If this has been helpful to you, click like and subscribe. You can drop a comment or a question below. We get back to you just as soon as we can, and you can follow us on Instagram as well. And if you'd like to learn more about your treatment options, you can visit yerbba.com for your personalized report.